Good afternoon, doctor. We'll start the session with the introduction first. So Kavita will give the introduction.
Good afternoon, everyone. I'm Kavita Sharma from Hello Kids Head Office. It's always my pleasure to connect with you all. Today, we feel honored and privileged to have with us a highly respected expert in pediatric urology, Dr. Harshita Kour, consultant from Fortis Hospital Mohali. To start with, allow me to introduce her remarkable achievements and profile. Dr. Harshita Kaur is highly skilled pediatric urologist at the Fortis Hospital Mohali, dedicated to providing advanced and compassionate care for infants, children, and adolescents. Trained in pediatric surgery and holding a prestigious fellowship in pediatric urology from Canada, she brings a global expertise to every child she treats. She specializes in treating complex urological conditions such as birth defects of the urinary tract, kidney problem, bladder disorder, childhood cancer, and urinary infection. Dr. Harshita is also an expert in minimally invasive surgery, laparoscopy, robotics, enterology, and kidney transplant care for children. Today, she will be guiding us on a very important and relevant topic, bedwetting, what's normal and what's not. Please join me in giving a warm welcome to Dr. Harshita Kaur, for her first Hello Kids YouTube live session. Over to you, ma'am. We welcome you for the session.
Thank you, Kavita. Thank you for such a lovely introduction. And good afternoon, everyone. Thanks for sparing your afternoon, evenings on Saturday, I would say. So, I chose this topic because, like you said, like this is one of the most common complaints that the patients come to us with in our clinic. So, just a minute. So to begin with, what is bedwetting and what is normal and what is not, right? So up to 5 years, children, they are still in the stage of toilet training. So we consider bedwetting till that age as normal. And it's very common in the kids who are like deep sleepers. And sometimes parents are to be blamed a little bit because this is usually a positive family history. So if a single parent is involved, the chances are a little higher. But if both the parents, they used to wet the bed in their childhood, then the chances are even higher. And boys, they wet the bed somehow more than girls. But the normal bedwetting is when the child has no pain, no burning, and no daytime symptoms. And the daytime urination is absolutely normal. Now you would ask me like how common it is. So just to give you a reference that, like I said, like till 5 years it's common, but we have children coming to our clinics around, I would say like 7 years old and above also, who have this problem. And 5 to 10% of them, even when they're 7 years old, they have bedwetting. And it will be very surprising to most of you who are attending this presentation that even 3% of the teenagers are also known to have bedwetting, and it continues even in 1% of the adults. So most of the children, they kind of grow out of it, and only 15% 15% of spontaneous resolution rate is known to happen. Like say if there are 100 children who are suffering from bedwetting in a particular year, so next year the 15 will grow out of it and the rest will have it. So that's how it works. So just one little query before I continue my presentation. Is it okay if I continue in English, or do you want me to do it in Hindi?
It's convenient in the English, ma'am.
Okay, yeah, sure. Then we'll do it that way only. Okay. So the common question that I get asked often is that, why is this happening? So this is just like a pot and water situation. So sometimes the capacity of the bladder is small and your urine production in the night is more, or the more common is that it's very like these are deep sleepers, and it's very, their arousal mechanism is not that great. It's not yet that developed because they're still in that age of development. But you would think that their sleep quality must be great, like that you're not able to arouse them. But the actuality is that these kids, they usually snore and their sleep quality is very poor. So you'll see like most of them, they'll be mouth breathers. The parents give us the history that, like they snore heavily. So all these things are known to happen in these kids. Now, what is not normal? So, if your kid is having daytime leaking episodes, or if he's having urgency, technically, which in simpler words means that you must have noticed that your child, he just rushes to the washroom, just like the boy shown in the picture here. He will just hold his groin and just rush to the washroom. So that is not normal. Okay. And if they have other difficulties, like you observe that your child, he groans a lot or he strains a lot when he's peeing, or if you have noticed that the frequency is not normal, either he's like many of the parents, they tell us, like he pees only one or twice in a day, or if he's peeing like really frequently, like every half an hour or every 1 hour, he's just rushing to the washroom. So that all is not normal. That is again abnormal. And there are associated symptoms with these children. So whenever we are looking at these kids, the main problem is that we usually focus on the night time only. We rarely care for the daytime symptoms. So it is very important for these kids to observe their daytime symptoms. So whenever they come to our clinic, we always start with their daytime history, because that is something that actually decides the treatment. Or one very other important condition or scenario that we come across in our clinics is that parents tell us that, like he was like fully toilet trained, he was dry throughout the night, but then suddenly for the past 6 months again he has started wetting his bed. So that again is not normal. So this child again needs to be evaluated deeply. Now, coming to the comorbidities, so I'm sure like all those millennials, they must have seen this Hum Saath Saath Hain kind of movie, which was very famous in its time. So here again, the bedwetting doesn't go alone. So there are some symptoms that go Hum Saath Saath Hain kind of situation is there. So the most common is the constipation. So again, this is again one of the fallacies. You focus either on the night symptoms only, or at most you would focus just on the daytime peeing habits, but not the bowel movements. So most of these kids, they are constipation. They have constipation, and sometimes they can have some behavioral issues, like they may be suffering from conditions like autism or ADHD. And like I said, they can have sleep disturbances. So obviously the things like ADHD, autism, and sleep disturbances, these are not something that parents can, like take care of. They must seek the help of a therapist. But constipation is a part that's very common, and that is something that can be taken care of by the parents by giving high fiber diets, taking care of their hydration throughout the day. And that brings me to the correct toilet posture. So let me tell you one thing, that poop and pee in pediatric urology, they say that these two things, they go hand in hand. So it's very important to establish the regular peeing of the child. So for the kids who come to our clinic with irregular habits, we always advise them, it is advisable for any other kid also, it's a good bladder habit to have at least 6 pees in a day. And they should be regularly timed, like every 2.5 to 3 hours. And if the need be, you should talk to the teachers at school that, like they should encourage the child and give them those pee breaks. And then they should drink adequately. I mean, I advise my patients that whenever you go pee, have a glass of water after that. That ensures that they have at least, like 6 to 7 glasses of water a day in addition to what they would have normally. And one very important thing is that we have to ensure a good toilet posture. So in this picture that you see above, you see that the legs of the child, they are dangling, right? They are high, and her bottom, if you look at the buttocks, they are sinking into the bowl, right? And this is the common scenario we see in our homes, because these are like toilets for the adults, not for kids. So the correct posture is that your knees, they should be slightly above the hip, not to the extent that your bums or your buttocks, they should dip into the bowl. And we have like these the seat that I have shown here. So there are like toilet inserts specially designed for kids. You can easily find them in a pharmacy shop, or it's even available on Amazon. Not a very costly thing, I think costing somewhere between 350 to 400 rupees, so that the bottom of the kid, it is well supported and not sinking. And they should be slightly leaning forward. And one very important thing, their foot, they should be adequately relaxing, just like shown in the second picture. So that's the adequate posture. So it ensures that the bladder of the kid, it is emptying properly, and the child is having a soft regular bowel motion. So this is something that I think like we should counsel most of the parents about, because they're unaware of this situation. And I have seen most of the kids in my house also, like, they are in the upper situation only, almost sinking into the bowl. So treatment, why is the treatment needed? Of course, it leads to poor self-esteem, especially as they grow in age and they become more self-aware, they're playing with their friends, and then they start avoiding the social activities like going for the sleepovers or going to some marriages. I have been in touch with many of the parents who tell me, like, we cannot go to the marriages for a night over because, like, he just pees and he's not very comfortable with the diapers being put in the night, because as they age, they don't like to put on diapers, right? And of course, it leads to parental stress. But the thing is, like like I said, like, if we take care of the daytime habits, most of them, they will grow out of it. 15% of the resolution is known, but there are still many like who will not grow out of their condition, and it is this subset of patients that needs treatment, right? So before I come to the medical part of it, my general advice would be, see, these days, most of the mothers, they're working and they often have this mom guilt that probably, they are not being a good parent. They're not taking good care of the child. Maybe that's why, like my child is having bedwetting for so long. So see, it is nobody's fault, right? It's just the matter of time. And it's just the maturation that is delayed in some children. And it is not your fault for sure. Neither child's nor parents, right? And I have seen some of the parents who, when come to the clinic, they tell me, like, we wake him up at the night also, like every 2 hours, and we tell him go pee. So see, that may help you for that specific night, but then it's not a long-term solution. In fact, it leads to the disturbance of the sleep, and then like you are in that loop again. So that's not a right practice to do, first of all. So let your child sleep, please. And focus on the daytime peeing habits of your child. Like I said, poop and pee, they go hand in hand. Don't ignore the constipation, I would say. So when I say constipation, it means it has to be a log like kind of stool which is very soft, and your child is not straining. There is no he's not groaning, he's not making faces, and he's passing stools at least once in every 24 to 48 hours. So that is something which would not be considered constipation and a normal bowel movement. And one important thing that in kids who are suffering from bedwetting, so you should avoid bladder irritants like these fizz drinks or high sugar and salty foods, especially in the evening hours. Coming to the treatment, so whenever these kids they come to our clinic, we evaluate them thoroughly, going through the history, going through their sleeping history, then what all is happening during the daytime, and then depending upon what all they are having. So we usually have two options to begin with. One is the bedwetting alarm, which again is like easily available in shops and even on, I think, sites like Amazon. It costs somewhere between, I would say, 3,000 to 5,000 rupees. So basically it works on a principle that there is a sensor that goes either into the sheet of your child or into the underpants, and then there is this kind an instrument which produces a acoustic kind of sound, and that is clipped very close to the collar of your kid. And whenever there is wetting of the sheet or the underpants, it just goes on, and basically it helps with the arousal mechanism of the kids. So, and it is the highest successful method, and the success rate is known to be around 70% for this. But for this, obviously, you need a very motivated child and a motivated family, who ensure that every single time the alarm goes off, even if the child, like many times the parents tell us, oh, we use the alarm, but then he had peed by that time, so we let him pee. Don't do that. Wake up the child, make him go to the washroom, because we have to work on his arousal mechanism. So that is one of the measures. Then the other one that patients come to the clinic to us very commonly is that, oh, we have tried this medicine, we gave the nasal spray also, but then it has not worked. We have been given it for so long. So this medicine, this is a kind of, I would say, like an escape drug, in a sense that, once your child is going for, once you're working on the rest of the things, like it takes time to come out of this. So if he has to go for a sleepover, or if he has to go to a marriage, so it will work on that particular day only, but it won't be a like a long term cure for it. So it's just an escape kind of drug in that sense. And with this, there is a rule of 30%, like 30% will be reliably dry, 30% will be intermittently, and 30% will show no response at all. So like I said, it will work only as long as they take this drug. Now, what to do with those kids who do not respond? So definitely these kids, they need reevaluation. They need additional investigations, right? So like so far, we try with the first line treatments only. And if only they do not respond, Then we go further for additional investigations like ultrasound to look for the capacity of the bladder. Then there is this urodynamic study, which looks at basically the capacity and the pressures of your bladder and whether this child needs any psychologist or psychiatric assessment. Like many of the kids, like I said, they have autism or ADHD. And because the centers that are related to the autism and ADHD disease, they are very close to your peeing center or the micturition center, as we call it. So that's why these patients, they grow out of bedwetting later on. So that has to be evaluated for sure. And like I said, like some kids, they have a disturbed sleep in the night, like, and that is evident by their heavy snoring in the night. So sometimes they have like enlarged glands just behind their nose, which are called like adenoids. So sometimes that needs removal. And once your sleep is smooth, then you kind of grow out of bedwetting. So that is something that needs to be evaluated by your pediatric urologist. And then, we can take a call. Then there are also second and third line drugs. I mean, they are available, but there's a slightly higher chance of side effects with these drugs. So we take a call for these drugs only after the assessment, and like once we are out of all our other arms and ammunition, that we go for these drugs. And sometimes we use combination of these drugs as well. Thank you. And I'm open to the questions of the parents and teachers. I'll be glad to answer. Hope this was a bit useful for you all. Hello.
Yes, ma'am, you're audible.
Yeah. So has anybody got any questions?
Ma'am, I'm having a
Yes,
question.
ma'am, I have a
Sure,
question.
sure. Please go ahead. Yeah.
Sir, you can go
Madam,
ahead
my chair.
and ask the question.
Yeah, please.
Sorry,
Yes, sir, please ask the question.
मेरा बच्चे का उम्र है 5 साल होने वाला है, 2-3 महीने बाकी है.
जी.
Just 4.5 years. All things were very good, but few days back I seen, मैं देखा है, मतलब वो बच्चा frequent urination कर रहा है, मतलब बार बार जा रहा है, मतलब 1 साल, मतलब 10-15 दिन से पहले हम देख रहे हैं frequent urination कर रहा है, मतलब everything, वो he drinks plenty of water and everything. बट ऐसे 7 दिन से मैं देख रहा हूँ बहुत फ्रिक्वेंटली जा रहा है, मतलब वो खेल रहा है तो खेलते खेलते शाम को खेल रहा है अगर, तो प्लेग्राउंड में तुरंत जा रहा है. 7 दिन से ऐसे देख रहा हूँ.
अच्छा. एंड इज ही कंप्लेनिंग ऑफ कुछ पेन वगैरह बताते हैं, जैसे
नहीं
पेशाब
नहीं
में
नहीं
जलन
नहीं
या कुछ वैसा? बस जस्ट
नहीं
आपको
नहीं
लगता है
नहीं
कि बार बार उसकी फ्रीक्वेंसी बढ़ गई है ना?
बढ़ गई है, मतलब घंटे में 2 बार जा रहा है, 2-3 बार या 4 बार. तो मतलब जब कर रहा है ना, बहुत अमाउंट इज सो स्मॉल, मतलब तो बहुत जो थोड़ा. So I have checked here an urologist. I asked him. So he firstly he suggested me for urine RE and ME, just and it was quite normal report. Just few days, 2 or 3 days back, I have done it. It was quite normal. So what to do, ma'am? Kindly suggest.
So yeah, normally see whenever we suspect, जैसे आपने बताया कि बार बार बच्चा जा रहा है ना, so the first thing that comes to our mind is कि इसको इन्फेक्शन हो सकती है यूरिन का, है ना? तो इसलिए हम पहले ये टेस्ट करवाते हैं, यूरिन रूटीन एंड कल्चर. So that is ruled out, right? So which brings us to the other point, which means that your bladder of your child is getting irritated because of something. So what I would suggest you is कि आप इसकी voiding को time कीजिए, right? Let him go, like even if he goes like 10 times in an hour, but set an alarm. Like जैसे सुबह 8 बजे उठता है, then 10 बजे, वो इसको करना ही है every 2.5 to 3 hours. And like I said, in the evening hours, अगर ये fizz drinks लेता है या जैसे chips वगैरह में बहुत ज्यादा processed food में salt and sugar
नहीं, no, nothing takes.
हाँ, so like avoid that. And one more question, how is his bowel movement? potty कैसी करता है आपका बच्चा?
Per day.
Every day is passing stool?
Every day. Yes, every day is passing. Soft
stool. Okay, so we are done with the constipation.
One thing, man, I like to add one thing, man.
Sure.
Just 1 month back, I visited my pediatrician due to another reason. So he started, he given prescription of iron syrup. So it may be that effect, maybe. Iron he's taking.
Iron he's taking, but I don't feel like that should interfere with his micturition. But then you should take care of his hydration a lot. आपको इसका जो पानी
he drinks plenty of water, madam. At least
so you have
his
to work
age is
on
4.5 years.
No, I don't
Yes,
think
two
like iron syrup
2 liter
can have.
water.
Yeah, that's good. That's really good. So I think then you need to work only on his, timed voiding, जिसको हम कहते हैं, every 2.5 to 3 hours. We will have to train his bladder. That's all I can see. Right?
मतलब 4.5 साल हो गए मैडम, मैं जस्ट 7 दिन से ऐसे देख रहा हूँ। तो पहले कुछ नहीं था, मतलब एवरीथिंग वाज नॉर्मल। रात को भी वो मतलब विदाउट ये करता है, मतलब सब नॉर्मल ही था। लेकिन 7 दिन से ऐसा कुछ दिक्कत आ रहा है मैडम। कोई
See, the first and foremost thing, जब ऐसा कोई acute अगर हमारे को प्रॉब्लम आ रही है, जैसे आप बोल रहे हैं कि 7 days में, तो जो पहली चीज हम रूल आउट करेंगे, that would be infection, right? And the good thing is that that has been taken care of, right? And how many times does he pee in a day? कितनी बारी जाते हैं नॉर्मली? इससे पहले जो क्या रूटीन
नॉर्मली
था?
नॉर्मली 2 घंटे में, आपने फास्टली यू टोल्ड 2 घंटे में 1-2 बारी, एक बार 1 or 2 times पहले पहले था, 7 दिन के पहले।
So what I would suggest is कि आप इसका एक voiding diary बना सकते हैं. Voiding diary means where you objectively pen down like how many times he goes and pee. So that will give you an idea. This is a very subjective
ओके
thing कि एक बारी में 10 बारी में जाता है. Just chart that for 3 days and then if you want, you can always come to me and you have my contact number. You can always message me.
ओके मैम, वन थिंग आई एम नोटिस्ड व्हेन ही इज वाचिंग टीवी, मतलब आफ्टर लंच शी डू वॉच टीवी, दैट टाइम ही इज नॉट पीइंग।
See, that is again a very common problem with the kids at this age, that they get distracted even when they're playing or like while they're watching the screen. So what they do is they avoid or they postpone their peeing. तो उससे क्या होता है कि
ओके
इनका ब्लैडर जो होता है ना, दैट्स व्हाट आई एम सेइंग, कि इनका ब्लैडर डायनामिक्स चेंज हो जाता है, इनका ब्लैडर बहुत ज्यादा स्ट्रेच हो जाता है. एंड लाइक आई शोड यू दैट पिक्चर, फिर ये जब जाते हैं, जब बिल्कुल इट्स एट द वर्ज ऑफ लाइक कमिंग आउट. So that's why their bladder needs to be trained and prophylactically also, like I said, like every kid he should be, like even if जैसे अभी इसको दिक्कत हो रहा है 7 दिन से, है ना, even then just work on his, इसको आता है सुसु या नहीं आता है, just make it a habit to send him every 2 hours and then advise him to take a glass of water after that. So उससे क्या होता है कि हमारा bladder properly cycle होना शुरू हो जाता है.
ओके ओके मैम, थैंक यू।
Yeah, I hope that helps you.
नो नो, एक्चुअली थैंक यू वेरी मच मैम।
Hi, ma'am. Hamsa here.
Hello. Hi.
I have a query with my daughter who is 5.5 years old. So she also does this bedwetting in the night, and sometimes she'll avoid. I mean, even if she had dinner by 9, she had plenty of water. We could see in the morning. I mean, she'll pass the urine so much. We will think how she, did not pass in the night, even after having this much of urine in the bladder. But sometimes, even if she is finishing dinner by 7:38, we are not giving any water after that, and she's peeing 2-3 times before going to bed. We ensure that by 7 or 7:30 or 8 we'll stop giving water to her, food, water,
Okay.
everything, so that by 9 or 9:30 she'll pass 1 or 2 times, so that
Okay.
a bladder can hold whatever she has in the night. So sometimes that helps. She doesn't pee. I mean, we have seen 3 days, 4 days also she doesn't pee, but for any day, like 4th day, 5th day, any day she'll pass. It is like that. I mean, I don't know if it is because of the water she's taking in the night, because many a times we have seen, if you are properly monitoring her with food, everything by 7:30, not having anything after that, by 9:30 if she sleeps, yeah, she doesn't pass. But then, yeah, I just wanted to check
Yeah,
what could
see,
be.
that is the general advice that we give to all the parents also, that like for any house, your daughter is 5 years old, so I would say that this is not something worrisome because her neuronal system is still in the process of maturation. But
Yeah.
again, this is a very important time of life to kind of like train their bladders, like I said, wherein we put them into the habit of this regular voiding throughout the day. And like you said, like for the ones, like she's 5 years old, so I'm kind of okay with what you're telling me right now, like once of a thing, like once or twice in a week, that's okay, she'll grow out of it. But for those in whom like if say like they continue or they've been wetting their beds like every single night, so that's the thing that we advise them, that like
Okay.
avoid salty and sugary foods in the evening hours, and usually take your meals like 2 hours before going to the bed. Avoid water if you can, and ensure that you pee just before going to the bed, and most of the kids, they respond to that.
Yeah, that's right. I again, her stool, everything is fine. Every day she'll pass, or sometimes it is 2 times a day. And morning time, peeing, everything is fine. She'll do properly without any issue. Yeah, only night time is a problem. So yeah, even I checked with her pediatrician. So he said 5 to 7 years. Sometimes it'll break in
Yeah, yeah.
7 years. So it's fine, but we will see if it continues. He said. So yeah, I just thought
Yeah,
of
just
checking with you.
make sure that like she does not have any of the day symptoms that I talked about, that she's not rushing to the washroom, she's not
Mm.
constipated. So if all these things are taken care of, most of the kids,
Yeah,
like
yeah,
they
the
grow
same as
out of it. Yeah.
symptoms what you asked us to monitor, right? Those are not there. She's fine daytime.
Okay, that's
Nighttime
great.
also, as I
That's
said,
great.
sometime like if I tell if I finish her food by 7:30, if she drinks water, 9:30 if she goes to bed after peeing, then there is no much problem. But yeah, sometimes we have given her late dinner, or she drank while sleeping also. If we have not monitored that time, yeah, definitely she will pass. It's like that. She's
Yeah.
not able to
So it's
control
just,
in the
like,
night.
yeah, you have to work on this thing, because obviously, yeah, like, she cannot continue like this throughout her life. So
Mm,
now it's good that you're kind of restricting her fluids or whatever, like, because she's still in the process of that toilet training. But what
mm,
I would suggest is that, slowly and slowly, as you see like the symptoms improve, try
mm.
pushing that time, like, say, like, now you're giving her dinner at, say,
Mhm,
7:30, and you kind of, do a time of, okay, no more water after 7:30.
mhm.
But we cannot live like that forever, right? So
Yeah.
once you see that the bedwetting is improving, so push it by half an hour, I would say, at a time. Like,
Mhm,
okay, so
mhm,
initially it was 7:30, let's make it 8 for 1 month and
mhm.
see what happens, and then go slow with the things, right? I'm sure
Okay.
like it will definitely work. Yeah.
Okay. Okay. Thank you, ma'am.
Thank you.
Hi, ma'am. This is Prashanti.
Hi, Prashanti.
Yeah. Ma'am,
Hi.
this is a case of 9-year-old. Okay. And the bedwetting and all those issues were not there. But the morning issue, what you said, rushing to the toilet, where
Mm-hmm.
like whether it is peeing or going to the potty, it was very, he goes in a rushed way, but nothing problem in the during the bedtime. So what is this case? Do we really need to worry about?
This is not something that we need to worry about, but
Okay.
this is another big discussion, that what you have described to me right now, another very common condition. So this is
Okay,
called
ma'am.
bowel bladder dysfunction. So
Okay, ma'am.
basically, see, in kids, like the pelvis area or the bony area, right, that surrounds your bladder and your bowel, that is very narrow in kids, right?
Okay.
So
Okay.
your bladder, which stores the urine, and your bowel, like your
Okay.
rectum or your intestines, which store the stool, they are in a very narrow space, right? So if your
Okay.
kid is constipated, right, if he's
Yeah.
not passing stools daily, or if he's holding a lot of stool, so what happens is that it kind of pushes or presses on your bladder, because they're lying close to each other, right? So it pushes
Mm.
on that, and it changes the dynamics of the bladder. So
Okay.
all you have to do is you have to take care of his constipation.
Okay, ma'am.
How often does he have the bowel movement?
He goes once in a day.
And is it hard?
Uh, Not really, ma'am. It's
Mhm.
normal. Like, it's not too hard and not too soft too.
So what I would suggest is, if you can pen it down, there is a Bristol stool chart,
Okay, ma'am.
right? So you can find it on net, right?
Okay.
And just go through that. So your child's poop should ideally be in a Bristol 4 category, which means that
Okay.
it should be smooth, long log. Even if
Okay.
like it's a log but it has cracks on it, then your child is constipated. Like, so you define constipation according to that. There's a very objective
Okay.
definition to that as well, right?
Okay, ma'am.
So you have to take care of the constipation part, and like here you have to go for timed voiding, train his bladder, because now that you're saying like he rushes and this that they postpone it, then their whole dynamics that gets affected, and we have to retrain it. And one more news that I should break to you is that this bowel bladder dysfunction, it really requires patience and motivation on
Mm.
your part, because it usually requires, like, I would say, dedicated 4 to 6 months to work on both these habits to come out of
Mm.
it, right? But
Okay.
it is something that you can definitely take care of at home. And if the
Mm.
need be, there is no harm in giving mild, like laxatives, or kind of helping him with little bit of medicines to have one soft bowel movement every single day.
Okay.
Yeah, to begin with,
Wonderful.
work with the dietary things, like increase his water intake, fiber
Yeah.
intake, go for apples with peel, go for cucumber, all these
Yeah.
things. Yeah.
Wonderful, ma'am. Thank you. Thank you so
Okay,
much for
thank
your
you.
inputs.
Yeah,
Yeah.
yeah.
Ma'am, there is a question in the chat box. I would
Yeah,
like to
sure.
convey it to you. My son is a 4-year-old and he passes urine in bed every day. He did not like to wear a diaper.
See, he's 4 years old. So, like I said, they like many of the kids, every kid is different. But usually, like till 5 years of age, we are not much bothered. So we would not do any fancy things, any bedwetting alarms or anything of that sort. But if you want to try, I think like you can begin with the bedwetting alarms if you want to. But I think like you can wait till 1 year. Till 1 year you can do that. And is he a deep sleeper? Whosoever has asked this question.
Hapeja Jaman Lashkar. Ma'am, you're there? Hapeja, ma'am, you're there? Ma'am, you can continue with the suggestion, ma'am. She might be hearing us.
So like I said, see, it's a, like in simpler words, it's a ghada and pani situation, you know. So या तो घड़ा छोटा है या तो पानी ज्यादा है, right? और या तो ये है कि बच्चा is like in deep sleep and is not able to, you know, like उसका arousal mechanism is not that great. So for that we need to check like whether that kid is snoring in the night, is hopefully there's nothing going on with the adenoids, you know. So but again I would say like 4 years is too early, I think, to go for any such kind of evaluation. But the general advice, make sure he's not constipated, make sure he's going every 2.5 to 3 hours during the day. We are taking care of the daytime habits, so that helps with most of the kids. And he's just 4 years old, so we need not worry. It's too early to worry for that.
Thank you, ma'am. Thank you for answering the question. Ma'am, I'm having a query.
Yeah, sure.
Since we are speaking much about the constipation and all, before the constipation arrives to any child, what are the precautionary measures the parent has to take?
So see, depending upon what age your child is, first of all, right, some of the kids, they're very picky eaters, right?
Suppose
So
the age group is 3 to 5-year-old, ma'am. In that cases, like what precautionary measures the parent has to take to avoid the constipation?
Okay, so see, one of the common things that I've been seeing off lately in my clinics is that most of the parents, they have been giving milk to their kids without sugar, and I don't know why. Somehow the sugar has become like a evil agent. You know, there, I think like on social media and everywhere there has been so much of talk, you know, like regarding sugar, okay, no refined sugar. So see, the milk per se, it is constipating, right? So if you give just milk to your child, I have seen parents coming to my clinic, oh, we give him 2 glasses of milk a day. And then when I ask them, okay, and how much sugar do you put? Sugar? No, doctor. We don't put sugar because it's refined. So see, these are kids, they are in a growing age. They need to have every nutrient. So they need to have sugar as well. In fact, for those kids, we do not tell them to stop milk. Obviously, we cannot, because it's, you know, like they are growing, their bones are growing, they are in the phase of development. So we cannot stop that. But we tell them to add sugar if they have not started. And if in case they have added sugar, just go a little bit higher on that. And in addition to that, make sure that they are having foods with fibers. Like most of the parents, they would give banana, and you know, like banana has these fine fibers. So they usually make it fancy for their kids, take out all the fibers and present it to their kid. So, you know, like work on the fibers. So if you're giving apple, if the kid is big enough, you know, like make sure that he doesn't choke. Give them fine slices with the fibers. Add cucumber to their yogurts. So these small things. And hydration. Put your kids into the habit of hydration, you know. So if you're following social media and avoiding sugar, so I think like follow social media and have like adequate amounts of water as well. There's so much of talk about fluids all the day. So it's a good habit. Put them in the habit. Yeah. And correct posture, toilet posture. So, you know, like don't let your child sink into that bowel. Buy that insert. It's hardly 350 to 400 rupees. Put that insert. Let the feet of the child, you know, like adequately relax so that his pelvis is fully relaxed, and like put them into habit of slightly bending forward with their elbows resting on their knees. So that's the correct posture. You know, that helps with the angulation and pushing of the bowel movements. Yeah, put them into that habit early on.
Thank you so much, ma'am. Pertaining to the same query, I'm having a
Sure,
one
go
more
ahead.
thing. Like as you mentioned that sugar and salty is not that good to intake at the evening time to avoid the
Yeah.
So when is the best time to give them milk along with the sugar?
So, yeah, that's a good question. Actually, you put me in a spot here. So, yeah, that's a good question. So, see, if your child is not, if bedwetting is not a great issue for you, like it's a one-off thing, then I would suggest like continue with your routine, whatever it was, give it in the evening. But if you're having, like you're still kind of fighting with the bedwetting thing, it's a good idea to give it in the morning hours. Yeah, you could do that. You can tweak it a little bit. I mean, like you can do it in the, when I say evening, like it could be 4 p.m., right? Right after he comes from the school, goes to play, then comes back. 4 p.m. I think is a good time. Like if in case you're working with the bedwetting thing. Yeah.
Yeah. Thank you, ma'am. Ma'am, like there is a one more question, like from
Mm-hmm.
the child's perspective, it is not
Yeah.
from the parent's perspective or a thing
Mm-hmm.
like that. Suppose a child is like peeing every day, and there is a concern like raised by the parents also, and it is a like the child will drop the confidence. Okay, they will feel that yes, I'm doing something wrong. How we can help the child to overcome this barrier psychologically and
Mm-hmm.
make them feel yes, it is okay, and you can overcome this.
Mm-hmm. So uh, that's a very good question. I must say that see the idea. So for the bedwetting treatment also. So in our treatment guidelines also, So when we start evaluating, so first and foremost thing that we discuss not with the parents, with the child is like how bothersome it is to you. So let the child take that call. Does he want to be treated for that or not? And yes, definitely when children they grow beyond a certain point of age, they become uncomfortable with that. For sure there is a poor self esteem attached to that, but being parents or being their teachers, we have to be smart enough, or we have to be emotionally intelligent enough to let them know that like this is normal. You can grow out of it. You can give them examples of like kids around them, your examples. Okay, when I was a kid, like even I was like that, but I grew out of it. So we will work on it together. We will make sure, and every single night, where he follows what you're telling him to do, like say, not having any salty or sugar foods. And if in case he doesn't wet the bed in the night, you can like you can give them some encouragements that, see, very nice, you have done that. And like for the time voiding, I have come up with a new thing in my clinic. So what do I do is like it's very difficult, like saying and doing, it's very difficult to tell your kid to go every 2 hours. They don't listen to you at this age. They are busy with their screens and rest of the things. So what I tell the parents to do is give them 7 stickers, like the normal stickers, like which you would get for 10 or 20 rupees, and tell them like every single time you go pee, like put that sticker on the back of your notebook. And by the end of the day, then you mark them. Okay, so you've got 7 star today. They are happy. That's a way of encouraging the children. That's how you have to find out the ways to work with the kids, right?
Ma'am,
So
in
that is
that
something.
sense, like if per day 7 times the child has to go for a pee.
Yeah, definitely, definitely. 6 is like bare minimum, and
Hmm.
the higher you want to go. I mean, that is
Okay.
because that is based upon usually the number of hours a child is awake for.
Hmm.
So that's how we counsel them. Like if a like the same question that you asked, oh ma'am, 7 times is too much. How are we going to take care? So I tell them, okay, one time once he gets up in the morning, one time before going to the school, one time break in the school, right? Once immediately after he comes to the school, that makes it four. Like one time he has to go before he goes to the bed. So that leaves you only 1 to 2 times in between, after he comes from the school immediately and before going to the bed. So I don't think that is like a big thing to achieve, right? So
Hmm.
if you really want, you can work on it. And the sticker thing, trust me, it really works. It
No,
really
ma'am,
works
it
for
will
small kids. They
really
really
work.
like it. Yeah, yeah.
No, even I like the ideology of having the stickers for the peeing and all. Ma'am, will it work for the constipation as well to train the children for the poop also?
For
The
the poop,
sticker.
obviously, we have to put them into, healthy eating habits.
Hmm.
And like, and many of the parents, like they'll because I have seen off lately, like I said, there is a thing against the sugar, which is good in a way also. But then when I ask them, then they'll be like, no, we don't give her any chocolates, we don't give her any toffees. But when then I say, okay, then what does she have her milk with? She just has 4 to 5 biscuits. So biscuits is all like refined flour, right? That's all maida. So we need to work on these things and put them into habits of having. Nowadays the good thing is like schools are having these fruit breaks also. So, give them those fruits which are like good in fiber, and work on these things. Mainly in kids, for kids, it is dietary manipulation only that will help you. And adequate water. So, like once you give them adequate water, that's like killing two birds with one stone. That takes care of your bladder part also and takes care of your bowel also. So every time they go pee, encourage them to have a glass of water. So that ways, like it works. It works wonderfully. I hope that answers your question.
Yes, ma'am. It's very relevant. Thank you so much.
Yeah, yeah.
Ma'am,
Ma'am,
there
I
is
have
a
one
one more
question.
query.
Yeah,
Yeah,
I
please,
think,
ma'am. Please, ma'am.
please, yeah, please go
Yes.
ahead.
Potty tray for kids, is it good or bad? Potty tray.
So as long as you are able to achieve that posture, like I said, if
Yes.
your child is, like the feet of the child, they're totally relaxed, and the knees of your child, they're slightly above your bumps, not like angulated, they're slightly above, like I showed in my presentation. If you're able to maintain that posture,
Yes.
there's no
Yes.
harm. Yeah. You just
Okay.
have to make sure that the bottom of your kid, it is totally relaxed, it's not sinking in, the feet are relaxed, he's not very much angulated, like as the kids grow and they're still on that small potty seat, then there's a very sharp angulation, so we have to avoid that. So
Okay. Okay,
yeah,
ma'am. Okay.
yeah. Thank you.
Welcome, ma'am.
Ma'am, there is a question in the chat box. I would like
Yeah,
to convey it to you. Okay.
yeah,
The
sure.
parent is asking that my child is a 6.5-year-old and in winters at night he has a issue like bedwetting. And
Mm-hmm.
also sometimes he knows that I wetted bed and wakes
Mm-hmm.
up, but it's after urinated in the bed. It's not before that. So what in this situation, what parents has to do?
So he's a deep sleeper for sure. So they have to take care of two, three things. First of all, whether their child snores at the night or not, that is something they have to make sure, right? And then they have to ensure that he pees immediately, before go. And how often does he do that? Like in a week, how would you number it?
It's 2 to 3 times, ma'am.
It's 2 to 3 times in a week. And do you think like particularly it has increased during the winters?
Yes, it is increased during the winter only.
Hmm.
Not,
Okay.
normally he is not doing in summer.
Mm-hmm, mm-hmm. So what I would suggest is go a little down on his fluid intake. After what time does he have dinner generally, and what time does he go to bed?
Till 8:30 at
He
night.
has his dinner, right?
Yes, yes.
And what time does he go to sleep?
9 to 9:30
Okay,
normally.
so a little tweak here. What I would suggest is that give him fluids 2 hours before he goes to before he goes to the bed, right? And ensure that he pees just immediately before going to the bed, and work on rest of the habits. He will grow out of it for sure.
Yeah, he is daily going before means before going to bed. He is going to urinate, but still he is having some issues during the night. But not for every day. But
Mm-hmm.
in 2 to 3 times he will do the same thing.
Okay.
And normally he
Mm-hmm.
also wake ups me that Mama, I wet the bed, so you can please
Mm-hmm.
remove my clothes and change with the
Yeah,
clothes.
yeah. Yeah,
Yeah.
I mean, like he's 6.5 years old, so you can try bedwetting alarms. And but
Okay.
for bedwetting alarms, like I said, like you really have to be motivated, and
Mm-hmm.
that has to be done at a stretch for like 14 days at least, right? Then you have to come back to us for a follow up, and then we see like how bad, or then you have to chart like every single night, like you're telling me, like like in a week 2 to 3 times, but it has to be more objective in that sense. So we monitor it for 2 weeks once we start with the bedwetting alarms, and then we see how the things proceed. I think
Yeah.
bedwetting alarm can help him. And but I would suggest like start with the easier things first, like focusing on his daytime voiding habits and avoiding water and fluids like last 2 hours of the day before he goes to sleep.
Okay, we'll try. Yeah.
Yeah. Okay.
Thank you, ma'am.
Thank you.
Any more questions?
Any more questions in the chat box?
No, ma'am. Actually, there was 2 questions which I have already conveyed to you.
Okay.
Any further questions, parents, teachers?
And one very important thing I want to convey here, that of lately, like we have seen, like like whenever we ask about constipation, so most of the times, like parents would tell us, no, he's passing stool every single day and it's a soft stool. So which means that there is no constipation, right? But on the contrary, when we get the x-rays done for these kids, so their whole bowel, it's like full of stool. So in this age, like when they are getting toilet trained around 4 to 5 years, so they are in the habit of postponement, which means that like they have other interesting things to do in their life, right? They are either on their screens or they're playing, they're busy with that. So just like how they delay their peeing, you know so the same way, what do they do is that they just go to the washroom, they go to the toilet, and they pass only that amount of stool which is enough for them to be comfortable. You know what I mean? Like they don't empty their bowels completely, they just empty a part of it, and then it keeps on piling. And like most of the times the parents are like surprised, no, but he has been passing every single day. And then we show them the picture. So just make sure that once your kid is in the toilet, like he's fully relaxed, and give them like adequate time, put them into that habit. Okay, even if you've done, sit for some more time, because they just pass a little bit and then they rush out. So just put them into that habit of kind of giving it like adequate time to kind of empty their bowels. So yeah, that is something like I have seen recently. So just keep an eye, like even if your kid, even if you've seen the stool and you think like, okay, he's been passing every single day, he still might be constipated and holding a lot of it inside, which could be the reason for like his night bedwetting, or like symptoms like rushing to the washroom is like, the first thing that comes to the mind of any pediatric urologist is, okay, what's happening with the bowel here? So yeah, that's one of the main culprits here, which we kind of overlook.
Ma'am, there is an interesting question which
Yeah.
you like love to answer, I think so. Except sugar, what else we can give?
Okay, except sugar, you can give dates if you want. If you're so anti-sugar, you can give dates. They are laxative in a sense, and you could give honey. Honey is a real superfood these days, so you could try that. If you don't want to give sugar, that's absolutely fine. You can give that. And if you are even fancier, then there's this new thing called monk fruit. You want to give that, you can give that. That's pretty expensive. So yeah, all these options are there.
Okay, ma'am.
Mm-hmm.
Ma'am, biscuits, ma'am, you said na biscuits are not good.
Yeah, they have a lot of maida
But
in them. Yeah.
What so you will give
What should you
biscuit?
give? So you're asking me the substitute for the
Yes,
biscuit?
substitute for biscuits. Yes.
That is something that you will have to sit with your kid and like decide depending upon his palate and taste buds, I would say. Yeah, but try to avoid biscuits for sure, because they have a lot of like refined flour in them. So yeah.
Okay, ma'am.
Ma'am, there is one more question from
Yeah.
the parent. They
Mm-hmm.
state that my child is 5-year-old. She usually go for a potty during the midday or evening, not in the morning regularly. Does it mean the sign of constipation?
No, no, no. If it is a soft, fully formed stool with no cracks on it, and he's passing it every single day, then it's not constipation. It doesn't have to be on the on one particular time only. And particularly in kids, there's a thing called gastrocolic reflex, which means that, as soon as they put something into their belly, so their colon, their large bowel, like that becomes activated, and then that pushes the food out. So it's a normal reflex in many of the kids. So even if he's doing in the midday or evening, it should not be a problem, as long as it is not hard, he's not having issues pushing that out, and it's a soft stool. Yeah.
Thank you, ma'am. Ma'am, since you have mentioned that like the child, like they will just to satisfy themselves, they'll just pass the stool and they will come
Yeah,
back.
yeah,
In
yeah.
certain cases, what happens, even the parents forces them to sit and motivates them to sit for a while and pass the stool to empty their bowel and all. There are certain cases where the child might feel the pressure and the pain passing the stool. In such cases, what the parent should do and how we have to motivate the children.
So see, if your child is having pain while passing the stool, then he definitely needs to be evaluated by a doctor, because most of these kids, what happens is that, like I said, like if their hydration is not good, if they're not passing stool every single day, so what happens is that whatever that pent up stool is inside the bowel, inside the, like the last portion of your bowel or your intestine. So God has this mechanism that when it reaches that portion, which is for storage, so it absorbs a lot of water out of it, right? So what happens over the time is that it becomes hard, right? And for some kids it's like hard like a rock, you know. So and when they pass that stool, so what happens is there is a minor cut, just like a, like how you would have with a blade or something. So they have a minor cut in their anal canal, which is not visible from the outside. And that is when then that happens involuntarily also, only because whenever they're trying to push stool through that cut, like it hurts them more and then they retain it more, and then that's like a vicious loop, you know. So for these kids, definitely it needs to be evaluated by a surgeon, and that condition is called fissure. So if your child has fissure, there's a proper treatment for that. Then we have to, like give certain drugs, that till the time that fissure is healed, we make the stool of the child, like kind of liquidy with the help of some laxative drugs, like which make the stool liquid. So for that one, definitely, I think that is something for which you should definitely see your doctor. If you think like every single time he's pushing to pass stools, or if there's many a times, parents tell us that he's okay, but then he groans a lot, and then there's, like small dots of, like red blood spots on the tissue paper, and not much bleeding, but just some spot, once in a while. So that is something that you should not ignore. Then this child definitely needs some kind of, like medicinal care, I would say.
Thank you, ma'am. Thank you for answering that query. And there is a one more question in the chat box. The parent is asking that daughter is a 7-year old. She goes for a
Mhm,
pee but takes time. I don't
mhm,
understand why. She feels comfortable in Indian toilet but not in the
mhm,
Western. She takes time in the Western. What is the
mhm,
cause?
mhm. So she's 7 years old. So I am kind of sure that her feet, they do not reach the bottom of the floor. So what I would suggest is to start with. I mean, like if she's passing in the Indian, there's no issue with that. There's no problem. But obviously, if you have like a English kind of, like commode at your place. So what I would suggest is please ensure that she has like a proper posture while she's sitting, just like how we discussed. Tell her to, you know, like bend a little forwards with her elbows resting on your knees, and making sure that her bottom or her buttocks, they are not sinking into the bowl, and her feet, they are fully relaxed. Because for passing stool, for passing urine, it is very important that your bladder, like your pelvic floor, that has to be fully relaxed. Then only you can pass. So it is true for anyone, but for kids, unfortunately, we do not have seats like, which are like specially tailored for them. So they have to do with the adult ones also, but then obviously we can make some little changes to make them more comfortable. So I think if definitely you work on her posture and taking care that she's not constipated, she will definitely be able to empty her bladder well. I hope that answers your question, Dr. Loveleen. Yeah.
Thank you, ma'am. Ma'am, this posture will help the child to avoid the constipation as well.
See, it does not help in avoiding the constipation, but helps in smooth movement of the bowel. You know what I mean?
Mm.
But
Yes.
if it is a hard stool, and if there are those issues that I discussed just now,
Mm.
even if, like he will make sure that he does not pass stool, because like he has pain. So voluntarily also the kid will make sure that he doesn't pass stools. But the postures that I discussed just now, they usually help with the, smooth bowel movement. So these are like adequate like in ideal scenario for a kid, or for that matter an adult, to have like a smooth bowel movement. So that's how it should be. Yeah. But if it is a hard stool, obviously the posture cannot change that, right? What is inside is inside. It's hard, it's hard. You can't help it.
Correct, ma'am. Thank you.
Yeah.
Thank you so much, ma'am. Any further questions, parents? I think we have done with all the queries, ma'am. And it was
Thank
really
you.
interesting. Thank you so much for the
Thank
beautiful
you.
insight and solving all the queries and the concerns which parents and the children are undergoing, and giving a best solution for how to take care of the children psychologically, mentally, emotionally, physically. And it's really a very beautiful insight spending a time with you and learning
Thank
about
you.
that
Same
very.
here. I'm more than happy to, help you guys. And if there's anything else related to the urological issues in the kids, I'll be more than happy to share like whatever I know. I'll be glad to help. And thank you so much. It was really nice interacting with you all. And
Thank you,
I
ma'am.
hope I could help some
Yeah, ma'am.
parents here. Yeah. Okay. Thank you.
On behalf
Thank
of the whole Hello Kids team, I would like to thank you, ma'am, and I extend my gratitude for this beautiful session. And I
Thank you
thank
so much.
all the participants for joining in on time and asking a valid questions to ma'am. Thank you so much.
Thank you. Thank you, and namaskar. Thank you.
Hi, ma'am. Hello, this is
Hello.
Sandhya
Hi.
Desai.
Hi.
Doctor, we are looking for some more sessions like this for the small childs and for the parents, knowledgeable. So I request you to share more topics with us.
Of course. Sure, sure,
Right, ma'am.
sure.
So I'll arrange it like in coming time, like in February month, we can have more sessions on that, ma'am.
Sure, sure, sure.
Right,
We
ma'am.
can
Thank you
talk
so
with
much,
our
ma'am,
team
for
and
such
we
a
can
qualitative
arrange. Yeah.
session.
Thank you.
Thank you so
Looking
much,
forward
doctor.
to more such interactions. Yeah.
Yeah, definitely. Thank you so much, doctor.
Bye. Thank you. Thank you.
Thank you, ma'am. Thank you so
Okay.
much. And thank
Bye-bye.
you to all the participants. Thank
Yeah.
you.
Thank you. Thanks to all the participants. Okay. Bye-bye.
Bye, ma'am.
Thank you. Bye.